I mean, ever since we've been growing up, we used to hear this Hausa saying, "Ai ta aihu amma yaron ya koma," which loosely translates to "she has given birth, but the child has gone back." For my discussion today, I wanted to talk about another topic of public health concern, which is child mortality. So, what is child mortality? Child mortality simply means the death of a child before reaching the age of 5, or the probability of a newborn dying before reaching the age of 5. Now, why are we talking about? Do you know that the annual mortality rates for child mortality in Nigeria is about 850,000, which means that annually, that's yearly, 850,000 children die before reaching the age of 5. So this is a serious concern. So now, what are the causes of this child mortality? Now, majority of the causes of child mortality are as a result of preventable communicable diseases, so like pneumonia, diarrhea, malaria. Okay, so these are the leading causes of child mortality, and then we have other ones like socio-cultural factors, socio-economic factors, demographic factors, and others like inadequate access to health services, limited number of staffs on ground, insufficient drugs. Okay, this all contributes to child mortality. Now, what can we do to prevent child mortality? So, since I'm a public health professional, I'll be talking about it systematically. So, what can we do to prevent child mortality? So, looking at it at individual level, family and community level, at the level of the media, the government, health workers, and even researchers, because it's a collective work. We have to all work collectively to reduce child mortality. So at the individual level, what can you do? Educate yourself through media. We have web pages for WHO, for UNICEF. You can look at these pages and educate yourself on child mortality. And mothers, go for ANC. That's where you get health education. That's where you get health talk, so they can educate yourselves on the do's and don'ts, the proper nutrition, the diet that you're supposed to feed yourself and also your child. Okay, go for immunization. Take your child for immunization, because immunization is where you get vaccines to prevent communicable diseases. Okay, at family and community level, what can we do to prevent child mortality? Now, family and community level, please allow your wives and your mothers and your children, allow them to go to the hospital, allow them to access care. Okay, because it's a recurring issue where we hear things like, I don't want my child to get immunized, the whole propaganda around immunization. I don't want my child to get immunized. I don't want my wife to go for ANC. So if she doesn't go for ANC, how will she get the knowledge? Okay, if she doesn't take her child for immunization, how can we prevent communicable diseases and reduce child mortality? Okay, so at the level of the media you have to advocate for child, to help reduce child mortality. So you have to bring in experts so that they can speak on this issue and educate the masses. Okay. As health workers, what can we do? Health workers, stop Japai. Let us stay in our country, help build it and make it better. At government level, government can put in policies to help reduce maternal mortality. They can increase the incentives and wages of our health workers so that they can stay in the country. Okay, as researchers, what can we do? More research should be carried out on ways to help reduce this maternal mortality, so as to make our country to have a lesser burden